when it comes to longevity, currently the techniques can make you live more than 100 years with full health and cognition. Males can have sex up to 100 years and reproduce. Unfortunately, females have a menopause at 50 and cannot reproduce after 50 years, and their vagina dries out, becoming unfit for penetration. So there is a problem for females when it comes to longevity. When a female is living up to 100 plus years, or want to live more than 100 years, there is an issue because of menopause. This slide shows the side effects during the menopause, and the highlighted ones are vaginal dryness and vaginal irritation, burning, itching, redness, swelling, vaginal discharge, clotted blood. These are the issues during menopause. But after menopause, the problem continues. For example, since going through the menopause, I often have vaginal dryness. The dryness makes having sex painful. Is there anything I can do about it? If a lady asks this question, the answer is no. As already we have seen, the major side effects of menopause are decreased desire, discomfort during intercourse, that makes sex less frequent or sometimes not desired at all. The major problems are vaginal atrophy, painful intercourse, negative impacts on self-esteem, relationship difficulties, and potential psychological distress due to feelings of inadequacy and loss of intimacy. So, what should be the strategies to maintain to have a satisfying sex life for older ladies until death? Because the longevity techniques can make both male and female alive, healthy, with cognition up to 100 plus years. Okay, the answer is the ladies should use non-penetrative sex, and masturbation is the only workable method for them. But if male partner insists penetration, they should use plenty of lubricants like coconut oil or water or jelly or any other lubricant. But they should not forget to get orgasms by masturbation. We should see the connection between stress hormone cortisol on the longevity. Cortisol is a stress hormone. Cortisol signals requirement of extra energy in the form of more sugar in the blood. High cortisol levels can contribute to chronic conditions that shorten life, such as neurological disorders. In any normal person, cortisol is synchronized with the sunlight, what we call circadian clock, making more cortisol when you wake up, so that the body will step up sugar in blood to be useful for the day's work. But by the time of evening and midnight, the cortisol hormone level is reduced towards zero. Let's see a graph. The graph in blue color shows the cortisol levels as per sunlight over over the whole 24 hours time. As you see here, the cortisol level is peak when you wake up around 6 a.m. or 7 a.m. and it decreases throughout the day, and by the time evening 5 o'clock it has decreased quite a bit, and in the night around let's say 1 a.m. the cortisol level is the minimum, reaching towards zero. Because if cortisol level is zero, the body will not put automatically extra sugar into the blood, but it will put more sugar in the blood at the time of waking up. Now, this is an automatic phenomena in everybody's body, synchronized with the sun. The curve shown in red is for people who are having stress and depression. When you feel depressed, the body thinks that you need extra energy to cope up the problem. So therefore, it steps up the cortisol production throughout the day. So even in the night, the cortisol is there, and it is even in the daytime it is more than what is required. But if the body is in depression, and if one is not doing any physical activity, or actually no energy is required, you are just upset and you are having stress. So what happens? The body, based on the signaling of the hormone cortisol, it adds up plenty of sugar into the blood throughout the day, and the body does not know what to do with the extra sugar in the blood. So what happens is that the sugar inside the veins is converted into fat, and the fat is deposited on the walls of the veins everywhere in your body, particularly in the heart side and the brain side, bringing problem for your long life. So your lifetime will be reduced in the form of heart attacks and blackouts. So therefore, cortisol is one of the major reasons for shortened life of people. To live longer, you must be always happy without any stress-induced cortisol as shown in the red. So why stress comes in old age? Some reasons, for example, loss of partner, worry about failed children in finance, health, marriage, etc. Stress due to lack of revenues and cash, worry about self-health. You have all kinds of problems in the old age, like teeth fall, hair fall, nail damage, wrinkles, eye bags, vision issues, hearing loss, falling in bathrooms, tumors, hernia, blood pressure issues, kidney disease, dementia, swelling in the legs, numbness in some parts, pain in joints, gallbladder stone, and more. Let us understand issues surrounding female orgasms. For that, we need to understand what is known as Skene's glands in the vagina. Females have two Skene's glands that are pea-sized, that secrete fluid during sexual arousal to help with lubrication and in pumping out a fluid during orgasm. Skene's glands in females are similar to the prostate gland in males that pumps out semen in the penis during the orgasm. So similarly, Skene's gland will pump into the vagina the lubricating fluid when the region around the clitoris swells up, and when orgasm happens, some women send out some amount of urine separately in parallel with the lubricating fluid from the Skene's gland during orgasm, called squirting.
lubricate the urethra during urination, potentially preventing urinary tract infections, much like the function of the male prostate. During sexual arousal, the tissue surrounding the skin's glands and the clitoris becomes engorged with blood. As the glands are stimulated, they secrete mucus-containing fluids that assist with lubrication during vaginal intercourse, making the experience more pleasurable. The volume of fluid produced can vary among women, with some experiencing a more forceful expulsion of fluid during orgasm, sometimes referred to as female ejaculation. Female ejaculation typically involves about a teaspoon, or 3 to 5 cubic centimeters, of fluid expelled through the urethra. This fluid appears somewhat like diluted, fat-free milk, tastes sweet, and has a smell similar to urine. The main component of this fluid is water, which forms the base for other components such as electrolytes like sodium, potassium, and chloride.
We also need to understand what are Bartholin's glands in the vagina. The Bartholin glands are a pair of pea-sized glands in the vulva that produce mucus to lubricate the vagina. The Bartholin glands are located in the vulvar vestibule, somewhere at the bottom of the vagina, on either side of the vaginal opening at the 4 o'clock and 8 o'clock positions. The Bartholin gland produces mucus to lubricate the vagina during sexual arousal. Okay, let's see in the picture. So this picture shows the vagina. This is the clit. This is the orifice through which urine comes out. And very close to it, like if you see here, if this is the clit, if this is the urethra, clit is here, urethra is here, just below, adjacent to the orifice where urine comes out, you are having the Skene's glands on both sides. So in this picture it will be somewhere here and here, right? Whereas Bartholin gland, there are again two glands which are pea-sized. They are located at the bottom part, away from the clit and away from the urethra, right? So why you are having two glands? Both the glands will emit fluids for lubrication, and so the Bartholin gland will give a mucus type of lubricant during penetration, whereas the Skene's glands, which are nearer to the clit, they will take part during the orgasm. So when you stimulate the region around the clit, the area swells up and the glands below it, they get squeezed up, and when one reaches the peak, the glands emit the fluid during the orgasm, right? So you understand, the Skene's glands are for the orgasm time, whereas the Bartholin's glands are for providing general lubrication of penetrative sex, right? Okay. before we come to diseases. There's one more lubrication mechanism. If a lady asks, am I wet during ovulation because of Bartholin gland discharge? The answer is no. The cervix produces cervical mucus, which is a fluid that can indicate when you are most fertile. The cervix is part of the female reproductive system. So the cervix produces the plentiful mucus at the time of your ovulation, right? Whereas Bartholin glands, they will be normally not doing any discharge, but only at the time of sexual arousal they will emit some fluid for lubrication. Okay, so now we have understood the three parts. So there are for women, they could have problems with these glands in the older age. One is possible diseases in the Skin's glands. Skin's gland cyst, a cyst that can form inside the Skin's gland. These cysts are usually benign, means not cancerous and asymptomatic, but they can cause discomfort during sex and difficulty in urinating if they enlarge. And they also may get infection or inflammation. The Skin's glands can become infected or inflamed, particularly if you are rubbing with your finger and if there is a bacteria in your finger, and if there is a scratch on the skin, so the Skin's glands may get infection, for example. Cancer, in rare cases, Skin's glands can develop cancer also. Infection in Skin's glands may cause swelling and stoppage of urine in females, similar to what happens to males with enlarged prostate gland. In old age, many men they face this problem when the prostate gland is infected, and when it's swelled up, it blocks the urine totally, creating trouble. Okay, what are the main causes of Bartholin cyst? So cyst can also be formed on the Bartholin glands. Experts believe that the cause of Bartholin cyst is a backup of fluid. Fluid may accumulate when the opening of the gland, the duct, becomes obstructed, perhaps caused by infection or injury. A Bartholin cyst can become infected with pus. So here what I am saying is, in the female part, these two glands, Skin's glands and Bartholin glands, they may have infection and cysts. So it is a health issue. Okay. Why I am telling all this? Because we are wanting to understand the mechanism of female orgasm. In my video earlier, the reference is given here. It is being told that only female humans in the animal kingdom, has the mechanism of orgasm. The animals generally don't bother about orgasm in the case of females. But because of this reason, all females do not get orgasm easily. Theoretically, every female can have an orgasm, and many females actually do not know what is an orgasm, because there is no sex education in villages, and in some females it is very difficult to bring orgasm also. It is said that in the world 10 to 15% of women have never experienced an orgasm, meaning they do not reach orgasm at all. Whereas the topic of this video is that we are going to increase the longevity by making more orgasms in the females. So there is an issue. Also, 50% of women say that they have difficulty in reaching orgasm with a partner. And 81.6% of women don't orgasm from intercourse alone, that is without additional clit stimulation. So the orgasm in females therefore is problematic, as you are seeing that 15% women have never experienced an orgasm and 81.6% of women don't get orgasm when they are doing sex with their partner. So then how to manage? We want more orgasms for increased longevity. The advantages of orgasm, we saw that a lot of hormones were released. Hormone regulation. Sex regulates hormone levels, which can promote regular menstrual cycles and reduce menopause symptoms, not in older age but in the younger age. Stress relief. This is the main thing. Orgasms can relieve stress and improve mood. So if stress is relieved, there is no cortisol, and therefore you will have a longer lifetime. No heart attack, no blackouts. And the orgasm also leads to improved relationships, reduced risk of heart disease, improved immunity, because it is said pleasurable sex may boost immunity, and the pain relief. Sex can help cure headaches and reduce physical pain. So what are the hormones released when you come in case of female? In fact, for both male and female. During orgasm, your body releases dopamine, known as the feel-good hormone, and oxytocin, sometimes called the love drug. These hormones increase feelings of happiness and other positive emotions, and they counteract the stress hormone cortisol. There are more hormones coming up at the time of your orgasm. Serotonin. The brain also pumps out serotonin, which is responsible for good mood, relaxation, and post-sex drowsiness, which can make us want to nap. That is after sex is over, after the orgasm is over. Both men and women may release oxytocin, though women typically release more of the feel-good connecting hormone. You also have more hormones released at the time of orgasm. Endorphins. It is a neurotransmitter that can reduce pain, alleviate stress, and create a sense of satisfaction. And adrenaline. This is a hormone that can increase heart rate, blood vessel dilation, and blood flow to muscles at the time of orgasm. So all these hormones are good for the body. The body is experiencing a pleasure, and that in turn is increasing the longevity. Particularly for the females, it is required in their older age. Another problem with older age is dementia, loss of cognition. No? Orgasm is associated with better cognition and potentially less dementia as you age. Orgasms flood your body with neurotransmitter dopamine, which floods your body with pleasure. So now we come to the point. What if a old female does not do any sex and does not get orgasms in the old age? This increases mental stress and cortisol levels that will decrease longevity and quality of life. The dried vagina gets hardened and brings health issues including cysts in Stein's gland, cyst in Bartholin's gland, urination difficulty due to swelling or infection in Stein's glands. So regular orgasms by using the female equipment will keep the female sex parts healthy and young. So we are concluding that females require lots of orgasms throughout their life, as often as possible. But some females do not get orgasms at all. Others do not get orgasm during sex with partner. What to do? This is a practical issue. The answer is use masturbation. We are suggesting a new technique. We are calling it as water jet on clit orgasm. That is at zero cost, but can bring 3 to 5 orgasms in one go in minutes. This will help those women who never had any orgasm so far also. How do you stimulate the skin glands and get an orgasm? The skin glands are surrounded with clitoral tissue which swells during sexual arousal. This swelling stimulates the skin glands to release a mucus-rich fluid. Spraying water softly around the clit arouses the area around the clit and the skin glands, leading to a quicker orgasm. We call this as a water jet on clit orgasm method. See the video. Assume this is your clit. So all you have to do is pour water around the clit for a minute or so, or until you get the orgasm. That's all. It will be no pain, no hurting of skin, and it will be really enjoyable. Within 1 minute, you can have the orgasm. You can also have multiple orgasm by repeating the procedure.